All right, so we are going to finish up the second half of our Understanding Cultural Diversity lecture. And first thing we're going to talk about is healthcare beliefs. So we know that the system in the United States tends to be called our biomedical healthcare system or our Western system. With this, we base the cause of disease on microorganisms, on disease cells, and on the process of aging. Once we've determined the cause of the illness, we look at eliminating that microorganism, conquering or slowing the disease process, and preventing the effects of aging. When we look at some of the beliefs of our Western system, we tend to encourage people to learn as much as possible about their illnesses. We also are making sure to inform people about terminal or deadly diseases. We teach self-care. We use medications and technology to help cure or decrease the effects of those diseases or illness. And we teach about preventative care. So remember things like vaccines, those yearly check-ins, medication, etc. Now, when we look at this from a worldwide perspective, we have to understand that not everybody follows along with that model. And since those beliefs can vary, it can affect how someone responds to healthcare or when they choose to reach out for healthcare. A lot of cultures have common beliefs about the cause of illness. They have beliefs about how we maintain or stay healthy, beliefs about how we respond to pain, and effective methods of treatment. Just like we've said all along, everybody in a group is an individual, so not all people in a cultural or ethnic group are going to follow and believe in these customs, but they still might be influenced by them. We might see things like herbal remedies, religious rites, other forms of ethnic and cultural healthcare. I know a lot of you learned some different things or forms in your cultural promotion project. So it's similar to some of those things that we talked about. We may see alternative healthcare methods. And a lot of this we're seeing more and more in the United States. Alternative are things that we're using in place of our more Western methods. If it's in addition to, then it's technically considered complementary. But some of these things could be chiropractors, homeopaths, naturopaths, hypnotists. Natural methods, so things like eating organic food, herbs, vitamins, antioxidants, mind and body control methods, so things that we do for relaxation, meditation, biofeedback, hypnotherapy, imagery can be helpful. Energetic touch therapy, so whether that's massage, acupuncture, acupressure, therapeutic touch. Some of our body movement methods like chiropractors, yoga, and Tai Chi, and some of our spiritual methods. So faith healing, prayer, spiritual counseling. I know we've all heard people say, I'll pray for you or I'll pray for them when someone is sick. So that would be one of those spiritual methods of healthcare in a way. I can't say this enough. Just remember that everybody has the right to choose the type of healthcare system and treatment that they think is best. So we as healthcare providers have to respect that right. Yes, we want to give all the pros and cons of what we're recommending, but we also want to make sure that we're talking with the patient. What is the patient's goal? What are their preferences? Because if they don't want to use any chemotherapy for their cancer treatment, but that's all I'm offering, I need to better understand where they're coming from to see what else I can offer them or how we can meet in the middle. Transcultural healthcare is where we're looking at every aspect of the cultural approach. So we're looking at the beliefs, the emotional needs, the spiritual feelings, and the physical needs of a person. As a healthcare worker, again, we need to be aware of how cultural preferences are going to influence behavior. This is going to allow us to make more of an effort to provide that care directed at meeting those patient-specific needs. We talked a little bit yesterday about holistic healthcare, but again, this helps just provide that biomedical aspect, but also recognize the use of those alternative care methods. So, how our mind helps us heal, how our spirituality helps us heal, and how our emotional responses are going to influence the care that we give or receive. So, now let's talk a little bit about spirituality and religion. So, spirituality is an individual's beliefs that they have about themselves, about their connection with other people, and about their relationship with a higher power. This is a way that someone can find meaning and purpose in life. Now, we may see spirituality expressed through religious practices, but they are not the same. Someone can be spiritual, but not religious. When we look at spirituality, it's an individualized and personal set of beliefs and practices that evolves and changes throughout an individual's life. So I know we've talked a little bit about it before, but what you believe now is not going to be, most likely, the same thing you believe in 10 or 20 years. We all grow, we all change, we all start to see things a little bit differently. Now, on the other hand, religion is an organized system of belief in a superhuman or higher power. So, when we look at religious beliefs and practices, we tend to see these associated or kind of hand in hand with a particular church. And religious beliefs or systems are going to give us a lot of different aspects or cultural beliefs about birth, life, illness, and death. We see a lot of this in just the founding of the United States, where some of those long-term beliefs came from. We may see effects in dietary practices. And just remember, with everything else, not every person in every religion is going to follow all of the same beliefs and rituals, and that's fine. When we look at some of the different types of religion we might see, monotheists believe in the existence of only one God. So Judaism, Christianity, Islam, one God and one God only. Polytheists are going to worship and believe in many gods. Some places we may see this are Hinduism, Chinese folk religion, some believers of Buddhism. An atheist does not believe in any deity or God, whereas an agnostic believes that the presence of God cannot be proved or disproved. So those last two are where we see sometimes some confusion. Atheist does not believe they exist. Agnostic believe it could exist, but they don't believe it's currently proven or disproven. Now, when we do healthcare, it's important in some aspects to make sure we understand what someone's beliefs are. For instance, if someone is in the process of dying or has died and they've asked for a priest, it's important to know if that person is Catholic. The Catholic religion requires or requests that patients be read their last rites, and that can only be done by a Catholic priest. So there are times when we may need to ask questions to make sure we understand their spirituality, their religious beliefs, and give them the opportunity to express those beliefs. So if there's any rituals they practice or any special diets, as long as it's not going to harm them while they're in our care, we need to show that respect and allow them to practice those things. So now the culmination, where does this all come to? How do we respect someone's cultural diversity? We've said this over and over, but remember that every person's a unique individual. So every person is going to adopt beliefs, form a pattern of behavior based on kind of a combination: their culture, their ethnicity, their race, their life experiences, their spirituality, and their religion if they follow one. Again, as healthcare workers, we have to be aware of the needs of everybody and be able to appreciate and respect personal characteristics of other people. We want to make sure we're listening as people express their beliefs so that we can start to appreciate the differences that are among other people. We talked already about this, but make an attempt to learn more about cultural or ethnic groups you see frequently. So if you work in an area where there's a high population of a specific ethnic group or cultural group, make sure that you have a little better understanding about some of their cultural practices. Ask questions. It's so much better to ask questions than make assumptions so that you can have a good understanding of someone's beliefs. Make sure you've evaluated all of the information before you form an opinion, and remember to recognize and avoid your own personal biases, prejudices, and stereotypes. And this includes being more aware of those implicit biases that we've talked about. Again, make sure that we allow the patients to practice and express their beliefs as much as possible. And again, you are not expected to adopt to someone's beliefs. You just need to respect them. Promote and encourage positive interactions with the patient's family. Be sensitive again to how they respond to eye contact, touch, personal space, and then make sure we're being respectful of their spirituality, religious beliefs, symbols, and rituals. So that's all for this. Next, we'll get into our study guide, but if you have any questions, just let me know.